Hi, this is Dr. Joe LeMaster, Local Health Officer for Johnson County, and today we're talking about monkeypox. So today we'll talk about what it is, where it came from, how to prevent getting it, and if you should have symptoms of monkeypox, what you need to do. So first off, what is it? The virus emerged in research monkeys back in about 1958, and the first known human case was in a 9-year-old boy in Africa in 1970. Since then, it has become endemic in Africa with thousands of cases occurring there each year. It has become an outbreak in the United States as a result of close contact and sexual contact that has happened in certain communities in the United States, where it has become more of a risk now in our public. There have been a few hundred cases of this only thus far. So, how is it spread? We want to emphasize first off that it is spread by prolonged close contact or sexual contact, and that you are not at risk of picking up this virus from casual contact, brushing against someone in the subway or sitting where they were sitting, or any of the sorts of things like that. This is something that is transmitted by close contact through breaks in the skin or mucous membranes, and the risk happens as a result of that contact. What are some of the symptoms of it? You've probably heard about this. It usually starts out with a sort of virus or fever, flu-like prodrome or symptoms ahead of time, and then is associated with small things that maybe look like pimples or a small boil, a small red spot that's very painful, and then these will break down and look like a small sore that's weeping. These can happen on various parts of the skin and inside the mucous membranes. When it happens within the anus or rectum or within the mouth, then it can be extremely painful. So that is what the symptoms are like. Prevention of this is the same as we've been talking about all along. You need to be very thoughtful about those with whom you are in close personal contact, especially if you are having close personal contact with a new person. Also, hand washing and the same sorts of things we've talked about all along the last couple of years are still very helpful in preventing any kind of potential transmission if you're in close contact with a person, let's say if you were living together. If you suspect that you may be developing symptoms which are suspicious of monkeypox, the first thing to do is contact your primary care provider, if you have one, to be able to get more instructions. Special swabs and specimens need to be collected. If you are a close contact of a person, somebody that is now known to have monkeypox, not just thinks they might, but has been determined to have monkeypox, there is a special vaccine available for it, and we can obtain that for you. If you are a person who's developed monkeypox or thinks that you might have, please be aware of who your close contacts were, as the people at the state will want to get in touch with them.